So now we are saying the bile very important. So how this process goes on, let us see the bile secretion by liver. So like about 600 to 1000 milliliters per day of bile is produced, and its important function are it's important for fat digestion and absorption because bile acids perform two functions, mainly two important functions. The first function of bile is help to emulsify large fat particles of food into minute particles, and surface is attacked by lipase enzymes and secreted in pancreatic juice. So you can see here the large fat molecules are converted into minute particles, and they're also attacked by lipase enzyme. It also tries to cut down this, and which is secreted next in the pancreatic juice. So this is how all juices mix, and finally liver plays important role to cut down them. And liver also aids in absorption of digested fat and products by intestinal mucosal membrane. And bile serve as a mean for excretion of waste from blood. So this waste include bilirubin, an end product of hemoglobin destruction, and even excess of cholesterol. So excess of cholesterol, bilirubin, all these waste products are excreted by means of bile. So now let us see the biliary secretion. It mainly have two stages. The first one is initial secretion by hepatocytes, which have bile acids, cholesterols, organic contents. It's secreted to minute bile canaliculi that originate between hepatic cells. So we'll see the diagram how bile secretion takes place. So it's better to see diagrams at last. First we'll complete the topic. And next one is the bile flows in canaliculi towards the interlobular septa, where canaliculi empty into terminal bile ducts and later into large ducts, finally reaching the hepatic duct and common bile duct. From this, the bile either empties directly into duodenum or diverted from minutes up to several hours by cystic duct into gallbladder. So the bile route may be first from the canicula, it enters towards the interlobular septa, where canicula empty into terminal bile ducts. So terminal bile ducts and later into large ducts, finally reaching hepatic duct and common bile duct. So to this common bile duct, even our cystic duct may also enter and form hepatic duct. So from this bile enters into the duodenum. So these all finally get released into duodenum, or they are delivered for minutes or hours by cystic duct into gallbladder. So actually bile may go into directly intestine from the duodenum, or it may also get concentrated in a gallbladder. So in its course by bile ducts, second portion of liver secretion is added to the initial bile in response to secretin and local hormone. So additional secretion is watery solution of sodium bicarbonate, which is secreted by epithelial cells that line ductules and ducts. So this second secretion increases total quality of bile as much as 100%. So we already discussed in our before chapters, like secretin is useful to increase the pancreatic secretion. Pancreatic secretion is mainly sodium bicarbonate. So because of secretin hormone, even this sodium bicarbonate water, this also comes and add to the bile. So because of this, the bile concent, you can see the total quantity of bile is now lot of increased because of secretin local hormone. Now till now we have understood the story how the bile has come. Now we need to understand how we are going to store and concentrate the bile, mainly means what is the role of gallbladder in the bile. So bile is continuously secreted by liver cells, but most of it is normally stored in gallbladder until needed in duodenum. So bile is always formed in the liver, but always it's not secreted. It is also stored in the duodenum. So the maximum gallbladder can hold is like 30 to 60 ml, as much as like 12 hours of bile secretion. Usually 450 ml can be stored because the water, sodium chloride and other electrolytes are continually absorbed by the gallbladder mucosa. So concentration remaining bile constituents that contain bile salts, cholesterol, lecithin, bilirubin. So this is very important. So what they mean to say is, actually gallbladder can store this bile for a lot of time, because gallbladder mucosa have a capacity to reabsorb water, sodium, chlorine. So because of its reabsorption, you can understand now the bile becomes concentrated only with the bile substance, so that it can store like about 450 milliliters. So the bile mainly contains what? Bile salts, cholesterol, lecithin, bilirubin. These four play a major role in a bile. So most of the gallbladder absorption is caused by active transport of sodium by gallbladder epithelium, and this is followed by secondary absorption of chlorine. So primarily the sodium gets absorbed, secondary chlorine ions get and water get absorbed, and other diffusible constituents. So bile is normally concentrated in this way 5-fold, but it can be concentrated like about maximum 20-fold. So more concentrated bile means more it has only the salts, cholesterol, lecithin, but no sodium, no chlorine, no water. So all this will get reabsorbed into the gallbladder. So now let us see the composition of bile. It is released by liver, of course, concentrated in gallbladder. So most abundant substance in the bile is a bile salt. So bile salts play a very important role in our. So first we need to understand actually what are bile salts, what are bile acids. So in a bile both are present, bile salts are present, bile acids are present. So that bile acids are mainly the bilirubin, those are the bile acids. What are the bile salts, we'll see about them also. So in large quantities, bilirubin, cholesterol, lecithin, electrolytes of plasma are released. Now let us see the CCK, that is cholecystokinin, how it stimulates the gallbladder emptying. Means cholecystokinin, I think it contracts the gallbladder so that the bile may be secreted out. So when food is digested like in the upper GI tract, the gallbladder begin to empty. When the fatty food reaches the duodenum like about 30 minutes after the meal, the mechanism of emptying of gallbladder by effective rhythmical contraction and relaxation of sphincter of Oddi exit the common bile duct into duodenum. So because of the contractions from the common bile duct we discussed already. So now the bile comes out into the small intestine upper part, that is duodenum. So CCK stimulated when fatty foods are present. So always remember, whenever we eat lot of fatty food, our CCK stimulates the gallbladder to release more amount of extra bile juice. So gallbladder also stimulated by vagus and enteric nervous system. So it also have other connections. So liver synthesis like 6 grams of bile salts daily. The precursors of bile salts are cholesterol, either in diet or maybe synthesis in liver. So during the course of fat metabolism. So mainly remember, the bile salts are formed from the cholesterol. Cholesterol is the mother or parent for the bile salts. So cholesterol, what happens? It converts into cholic acid or it breaks down into quinidioxycholic acid. So now this cholic acid may bind with either glycine or with taurine. If it binds with glycine, it forms glycoconjugated bile acids. If it binds with taurine, it forms tauroconjugated bile acids. So this both bile acids are mainly the sodium salts. They form the sodium salts, and these sodium salts are secreted in the bile. So the salts, the bile salts are nothing but which are forming from the cholesterol. By this breakdown they become conjugated and they form. So bile salts mainly have two important roles in intestine. The first one is detergent action on fat, that is they decrease the surface tension of particles and allow the agitation in intestine so that they can break the fat into smaller size. This is called emulsifying or detergent function of bile salts. So bile salts mainly do this function. They try to break down the fat, and they also help in absorption of fatty acids, monoglycerides, cholesterol, other lipids which are from the intestine. They form the small complex with lipids called micelles, and these micelles are semi-soluble in chyme because of electron charges of bile salts. So without bile salts in intestine, 40% of ingested fat is lost into fecus and there may be nutrient loss. So remember, bile salts are mainly useful for the fat absorption, fat breakdown. So if a person eats more amount of fats, you may think they have more bile salts, right? Because they need to cut them out. So now let us see the enterohepatic circulation, very important. So 94% of bile salts are reabsorbed into the blood from the small intestine by diffusion in the mucosa. So in small intestine and remaining by active transport, the process by intestinal mucosa in distal ileum, then enter the portal blood and pass back to liver. So what happening? 94% of bile salts are reabsorbed into the blood from the small intestine by diffusion in the mucosa. Before we have discussed, the small intestine is breaking down the fats into its micelles. It is converting them into salts, right? So these are absorbed now by a small intestine and remaining by active transport by intestinal mucosa and distal ileum, then enter the portal plate. So this bile salts are now entering the portal plate and again passing back to the liver. So by reaching the liver and during first passage by venous sinusoids, the salts absorbed back into hepatic cells and resecreted into bile. So this is like a circle. From the bile salts, they are coming into portal plate. From the portal plate, they are going into the liver, and from the liver, they are again coming back to the intestine. So by reaching the liver during first passage by venous sinusoids, salts are reabsorbed back into the hepatic cells and resecreted into the bile. So 94% of salts recirculated into the bile 17 times. This cycle continues 70 times before it is carried in the fecus. So like this, from the bile is nothing but first from the intestine to the liver, again from the liver to the intestine. So like this 17 cycles. So salts which are lost by the fecus are replaced by new salts which are formed by the liver cells, and this recirculation is called enterohepatic circulation of salts. So whenever there are higher amount of bile salts, then there will be higher amount of bile secretion. So normally the bile salts will be like 2.5 grams. So if you give artificial supplementation of this bile salts, of course it will lead to more increase in secretion several times. So if bile salts are absent, that liver may produce now, because as there are low bile salts, liver tries to produce now more amount of bile salts. So because of production of more amount of bile salts, now it tries to increase the secretion of the bile. So we are coming to final part, the role of secretin in controlling bile secretion. So secretin, it already useful for increase pancreatic secretion. So actually it is indirectly also related to increase in bile secretion after the meal. So secretin mainly leads to increased sodium bicarbonate water which pass into the small intestine and joins the bicarbonate from the pancreas. So like 1 to 2 grams of cholesterol is removed from the plasma and it is secreted into bile each day. So bile salts or lecithin, they bind with cholesterol to form micelles, and the bile concentration in gallbladder is even salts plus lecithin, they also become concentrated. So abnormal conditions like cholesterol may sometimes precipitate in gallbladder and form cholesterol gallstones. So the people, like the person who have high fat diet, because we have seen here, whenever there is cholesterol, it is getting precipitated more in the gallbladder and it is a chance for forming cholesterol gallstones. So the people who are eating your high fat diet, they are having a higher risk of gallstones of cholesterol, or any infection and chronic inflammation of gallbladder. Then the absorptive capacity of gallbladder will change, so it allows excess water and bile salt absorption by leaving cholesterol. So because of abnormalities, even now the gallbladder tries to reabsorb the bile salt. So because of this, the cholesterol is remaining in the gallbladder in a great concentration. So cholesterol start making crystals in inflamed mucosa, and late means after few days later it may form the large gallstones. So this may be the cause of how the gallstones are formed in a gallbladder because of cholesterol. Now the final one, measurement of bilirubin in bile as clinical diagnostic tool. So what is bilirubin, how it is formed, let us see. So the greenish yellow pigment is a bilirubin, which is a major end product of hemoglobin degradation, and this bilirubin is valuable tool for diagnosing both hemolytic blood diseases and also various types of liver diseases. Remember, bilirubin is used to find out both hemolytic, because hemolytic means RBC are breaking down. So in that kind also we can find out, because if RBC break down only, this bilirubin is released from the hemoglobin. So we can find out both hemolytic blood diseases and also different types of liver diseases. So whenever the RBC gets old, its cell membrane gets ruptured, so hemoglobin is released, it gets phagocytes by macrophages. So because of this is called reticuloendothelial system. Now the hemoglobin is exposed out, and this gets break down into globin and heme, and this heme is a free iron which is transported in the blood by transferrin. But other than heme, if heme gets blocked down, it may also form some straight chains of 4 pyrrole nuclei. So this straight chains with 4 pyrrole nuclei, they are acting like a substrate for the bilirubin. and this bilirubin next converts into biliverdin, which is a first form product, and this biliverdin finally forms bilirubin. This bilirubin is of unconjugated. Unconjugated means it is not added with anything, so it is called unconjugated form. This is mainly released from the macrophages into the plasma. So now as the bilirubin has come to plasma, this bilirubin now it gets attached to the plasma protein, that is albumin. So bilirubin along with albumin, it is transported in the blood and also in intestinal fluids. So now this this bilirubin and plasma albumin, they enter like this only in a combined form into liver, and in the liver they get conjugated 80% with the glucuronic acid to form bilirubin glucuronide, and also 10% it binds with sulfate, it is called bilirubin sulfate, and other 10% may remain attached to some other particles or some other compounds, and finally all this together, this is conjugated. So before we have seen unconjugated, now we have seen this conjugated. So now this conjugated bilirubin, it travels by bile caniculae and finally it gets released into the intestine. So this is how the bile is formed, and this is how it is entering into the mainly duodenum of the intestine. So in intestine what happens? In intestine the conjugated bilirubin is now connected into urobilinogen. So this urobilinogen is soluble, it is reabsorbed in intestine mucosa so that it can go again back to the gut. So 5% it is excreted in kidneys to the urine. So in urine, now what happens? This urobilinogen is acting with the air. Of course, when urine comes out, it gets exposed to the air. So because of this, it gets oxidized and converts the urinobilinogen into urobilin. And also in fecus it will, because in fecus also the air is coming, so this urinobilinogen is oxidized in the fecus and forming stercobilin. So stercobilin in fecus, urobilin in the urine. So now finally we have jaundice. So jaundice is nothing but we have understood all this excess bilirubin, how it is formed. So this jaundice is nothing but excess bilirubin in the extracellular fluid. So we have extracellular fluid compartment. So if there in that compartment if we have lot of bilirubin, that is called jaundice. So jaundice is yellow tint. It's like a tint or coloring to our body tissues, including yellowness of skin, deep tissues, and also sclera of eye. So this is what is called jaundice. So we'll discuss it about detail in pathology. So by this we completed all the functions of liver. Now it's time to check out the diagrams from our textbook and conclude this chapter. So this one we already done, and here you can see the functions of liver: a reservoir of blood, blood cleansing, metabolic, secretion of bile, storage function, role in blood coagulation, catabolic excretory function, everything already covered in video. And here you can see the liver secretion and gallbladder emptying. So because of vagus stimulation cause weak contraction of gallbladder, it will lead to emptying of bile, and bile acids via blood stimulate the parenchymal secretion. Secretin via bloodstream stimulate liver ductal secretion. Bile stored in concentration up to 15 times in gallbladder. So the cholecystokinin via bloodstream cause gallbladder contraction, relaxation of sphincter of Oddi. So because of all this function, finally the bile is released into the duodenum. And here we have the cellular mechanism of metabolism, and here we have how the primary, secondary bile acids are formed, how they are traveling. Bile acid synthesis, the amount of bile acid return controls the rate of synthesis. You can see intrahepatic metabolic disorders, intrahepatic obstruction. So in different conditions how it is going on. And you can see how from the caniculae the bile is getting released, the synthesis process, all this. Bile acids reabsorbed from intestine. Here you can see the circulation, intrahepatic circulation diagram. And here you can see the formation of gallstones. The causes may be too much absorption of water from bile so that it gets more concentrated, too much absorption of bile acids from bile, or too much cholesterol in bile, or inflammation of epithelium. So these may be the causes. So course followed by bile during rest, during digestion. So these are the stones which are formed in gallbladder. And here we can see the bilirubin formation and secretion. So this is in plasma, this is in intestinal contents, this is urine. So in plasma, mainly the red blood cells which are going to die, reticuloendothelial system, heme oxygenase converted into first product biliverdin. This is first unconjugated bilirubin in the liver, and from the liver it enters into intestine. After entering intestine, it's get conjugated mainly with glucuronic acid, right, and it forms urobilinogen, and next it forms stercobilinogen. Oxidation forms stercobilin in intestine. So in feces it is released as stercobilin, whereas in urine urobilinogen is converted in urobilin in urine. In the liver, this urobilinogen is now transported to the intestine and urine. So this is a main flow chart for bilirubin formation. So by this we completed all the functions of liver.